Good morning students, very good morning. So welcome to our second session of Physiology, Inicet Premier League IPL 2024. We started successfully and obviously we will complete it successfully. So there is no doubt in it. So it's morning, a fresh day, so we'll start as fresh, right? We'll start with a fresh mood. So part 2 of Physiology, let's get into the topic. So today's topic is, I think yesterday we just finished up to autonomic nervous system control of GIT. So today we'll talk about the GIT movements. GIT movements, right? So what is meant by the movement of the so-called GIT layers or the movement of GIT structures? What is that movement called? Peristalsis. Peristalsis, the movements of GIT structures by which it gives the required momentum to the flow of bolus or food to move along the GIT tract, right? So GIT movements. So we will discuss something about GIT movements. So come to the how does the peristalsis generated? How does the peristalsis generated? But actually what is meant by peristalsis? Peristalsis is the action which is being produced, or it is the movement which is being produced by the GIT tract due to changes in the potentials in the nervous system which supplies the GIT, which leads to food movement in forward direction. So you can ask me a question, sir, is there a backward direction of food? Is there a backward direction of the food movement? Yes, there is a reverse movement or reverse movement of the food in a backward direction. What is that called? Regurgitation. That is called regurgitation, or also called, or what we can call it? We can call it as vomiting. It is the backward movement of the food. It is the backward movement of the food, that is called as regurgitation or vomiting. So peristalsis, that is something, the food movement is observed in the forward direction. But how it is produced? It is produced when BER, basal electrical rhythms which are produced with accompanying of food as a stimulus. You can take it, food, hormones, calcium, anything acts as stimulus, but in case of digestion, food acts as a stimulus when accompanied with basal electrical rhythm causes distension and release of some neurotransmitters, calcium, etc., right? So this basal electrical rhythm we studied yesterday, right? Basal electrical rhythm which was produced by duodenum, the most powerful basal BER producer. How much? 12 per minute, right? 12 per minute. Lowest is cecum, 2 per minute, right? So basal electrical rhythm when accompanied with food obviously leads to distension and release of neurotransmitters as well as calcium, etc., which leads to front or anterograde movement, as well as retro and back movement. So what is meant by front or anterograde movement? This front or anterograde movement is maintained by vasoactive intestinal peptide, or you can call it in a shortcut manner like VIP, vasoactive intestinal peptide, as well as nitric oxide. So listen clearly, students, listen clearly. What actually happen is this vasoactive intestinal peptide and nitric oxide. What is a nitric oxide? What does nitric oxide do? Can anyone tell? It's a dilator. So what does they do? They obviously cause vasoactive intestinal peptide, and nitric oxide causes dilation. or in case of GIT what they do, relaxation of, they cause relaxation of lower esophageal sphincter, right. So what happens is the nitric oxide as well as the vasoactive intestinal peptide, these two, they cause relaxation of lower esophageal sphincter. So that's why the food can move easily towards the forward direction. That means from mouth to oropharynx to coming to backward, that is towards the esophagus, and all along the esophagus it is coming towards the lower esophageal center. So how does the food move in a forward direction? Why not it is going in a backward direction like this? Why it is moving in a forward direction like this? Because there is a reason. The so called vasoactive intestinal peptide as well as the nitric oxide, these two components leads to relaxation of the lower esophageal sphincter as well as the distal parts, thereby leading to forward movement of the food. And only this forward movement leads to passage of food? No, there is one more mechanism that gives the support, that is backward movement or retrograde. Backward movement or retrograde. So who does act on the backward stage? That is acetylcholine, then substance P, etc. These cause contraction in the backward region. So this backward contraction accompanied with forward relaxation leads to flowing of food or moving of food towards the forward direction or towards its destiny. See, I will explain it clearly with a diagram. Wait. So let us say like this is mouth, right? This is mouth. Okay. So this is the GIT tract. Say something like it is a esophagus. So let us say like the bolus is here, the food bolus is here. This is the food bolus. Okay. This is the mouth. Okay. This is the, say something like esophagus, right. So this part, wait, I will draw it completely. So you have two regions. First one is this one. So this is called front end. This one is called back end, right? This one is called back end. So what happens is, in the front region, in the front portion of the food, front portion means which is before the food, right? This one is backward, means the region which is present towards the mouth is taken as backward, and the region which is faced towards the stomach is front end region, right? So in the front end region, the vasoactive intestinal peptide and the nitric oxide, they relax this region. With the, how? Due to action of whip and nitric oxide, relaxation occurs here, dilatation occurs. So the food can slowly get down, slowly moves towards like this. And in the backward region, acetylcholine, substance P and some other components, they actively contract, they make the tissue contract. So here in this region, what happen is squeezing occurs. This acetylcholine, substance P just induce the nervous tissue present here, they excite those nervous tissue, leading to squeezing of this tissue, that leads to contraction of the tissue present in this tract. So that contraction leads to pushing of bolus towards the forward side. Okay, now you understand. So in that way peristalsis slowly occurs. Now I will ask you a question. Where does these two components present, vasoactive intestinal peptide and nitric oxide? It is present in where? Can anyone? So what happens if WIP and NO, that is nitric oxide, if they were lost? What happened? Loss of vasoactive intestinal peptide and nitric oxide leads to which condition? So loss of nitric oxide and vasoactive intestinal peptide from Auerbach's plexus. Auerbach's plexus. Loss of vasoactive intestinal peptide and nitric oxide from Auerbach's plexus leads to increased lower esophageal sphincter tone. That leads to which condition? Very famous condition, very important topic in surgery. Anyone? Achalasia cardia. Very good. Achalasia cardia. Now what is the sign seen in achalasia cardia? Bird beak sign. It is bird beak sign. Okay, bird beak sign seen in which investigation? Bird beak sign is seen. That is also very important. Barium swallow. Remember, barium swallow. See, in surgery we will discuss all types of barium follow through, barium swallow, barium meal, barium enema. We will discuss all the types of barium related investigations, where we will do follow through, where we will do swallow, where we will do barium meal, where we will do enema, all these things. So this vasointestinal VIP and NO, VIP NO loss from where? Auerbach's plexus. Loss of VIP and NO leads to increased lower esophageal sphincter tone, which in turn is called as achalasia cardia. So this is the mechanism behind achalasia cardia. So if you know the physiology, you know pathology, you know medicine, you know everything. Ultimately you can deduce pharmacology also. Okay, so that is the mechanism behind it. Okay, so that is about front or anterograde peristalsis, retro or back end peristalsis, or a back end mechanism. So what about, is there a reverse peristalsis? Yes, there is something called reverse peristalsis. There is something called reverse peristalsis. What is meant by reverse peristalsis? Nothing but vomiting or regurgitation is called reverse peristalsis, right? But what is the main component? What is the main component that keeps the stomach clean? Why? Because if you want new food to enter, you should obviously increase the appetite. If you want to increase the appetite, brain should know that stomach is empty, which leads to increase in HCl, which leads to increase in appetite. Increase in appetite is caused by which hormone? It's ghrelin. Obviously it's ghrelin. So how does this mechanism takes place? What is the real reason behind it? So someone is cleaning the stomach for all of us. That is nothing but MMC. That is nothing but MMC. What is meant by MMC? Migratory motor complex. Migratory motor complex. What does this migratory motor complex do? See, migratory motor complex, also called as hunger pangs, or you can also call them as broomstick. Broomstick of what? Broomstick of GIT, or you can also call housekeepers of GIT. Housekeepers of GIT, housekeepers of GIT. Okay, so what does this migratory motor complex do? These are produced by empty stomach. Remember, these are produced by empty stomach, and what they do is they clear all old contents. They clear all old contents for what? To prepare for next meal, to prepare the stomach for next meal, to prepare the stomach for next meal, to prepare the stomach for next meal. Okay, now what is the duration? So if you want to produce this MMC, migratory motor complex, if you want to initiate this condition, there should be some time period na, there should be some time schedule na. For if you want to go to school, you will go to school by 9 o'clock. If you want to go to college, you will go to college by 9 o'clock. So there is a pinpoint following of a time schedule. So obviously even MMC should have a time schedule. So what is the time schedule? It is nothing but the duration is very important. NEET PG question, 90 to 100 minutes. Just underline it with a marker. It is 90 to 100 minutes duration. See, I am telling some important points. What is the BER, basal electrical rhythm rate of duodenum? It's 12 per minute. What is the BER of cecum? It's 2 per minute. What is the duration of MMC after each food or meal intake? 90 to 100 minutes. You just remember these. These are stock NEET PG questions. Okay. Now, so duration 90 to 100 minutes. So what happens? For example, if you consume some food, for example, if you wait, I'll write here, I'll clear it off. If you consume some food, for example, you had your lunch. So what this food will do? This will decrease the activity of MMC or migratory motor complex and increase the peristalsis. We already discussed now how the food increase peristalsis. Food binds with or accompany with basal electrical rhythm potential to cause peristalsis. So they increase the peristalsis as well. This leads to also increase the activity of motilin hormone from ammo cells of stomach, as well as duodenum also. So this in turn leads to increase or initiate all the movements in the GIT, that is peristalsis, nothing but peristalsis. So you understand the mechanism, right? So when food is consumed, I already said food is also one of the stimulus. This food with accompanying with basal electrical rhythm cause decrease in migratory motor complex and increase in peristalsis. This increase in peristalsis leads to initiation of motilin hormone from the ammo cells of stomach as well as the duodenum. This in turn leads to different or various increase in movements of the GIT. Got it? Okay. So this is all about peristalsis. Now if you ask me about mass movements, what is meant by mass movements? Defecation, man, nothing but it's about defecation. So for defecation by colon, what happens is defecation by colon as well as rectum also, right? Defecation occurs through colon as well as rectum, but due to activation of which neurological tissue? Can anyone? Which neurological tissue? There should be some initiation, right? The ganglionic cells. Ganglionic cells of Which tissue? Ganglionic cells of Auerbach's plexus. See, always remember Auerbach's plexus is this much important. This much. You can't even imagine. We just simply study the histology, that is Auerbach's plexus or these all myenteric plexuses, everything we will study. But what actually is the real reason behind studying all this is because in understanding the physiology they are very much helpful. So the ganglionic cells present in the Auerbach's plexus, they initiate the required potentials. They initiate the required potentials to bring about a change in the neurological state of the GIT, followed by defecation process that goes on with colon and rectum. So what is the frequency of defecation in a normal individual or an adult? It's 1 to 3 times per day. It's 1 to 3 times per day. Okay. Now can you tell me in which condition this phenomenon is absent? It's a very important sure shot stock question. Actually an image will be given regarding that question. If you know the real physiology, then obviously you can tick the answer. So ganglionic cells of the Auerbach's plexus are absent, leads to stasis, defecation will not occur. Which condition? Absent in Hirschsprung disease. Absent in Hirschsprung disease. Hirschsprung disease, right? Or you can also call this condition as megacolon. Or you can also call this condition as megacolon. Okay. So actually all of us, we need good bulk of stool. Good bulk of stool or feces for proper bowel movement. Can you tell me which component of food gives bulk to the feces? Which component, which nutritional component gives bulk to the feces? Can anyone give me an answer? It's given by fiber. That's why you should always include fiber in your food. Daily dietary intake, you should always have fiber. So increase dietary fiber. Increase dietary fiber gives good bulk to stool. Good bulk to stool. So what are those types of dietary fibers that you will be giving to the human body? That is cellulose, lignin, pectin, chitin, inulin, etc. These are the type of dietary fibers that you should include in your daily food intake. I think inulin will be discussed somewhere. Where? Anyone? Inulin we discussed somewhere. We should use inulin as a dye for estimation of a body fluid component. What is the dye used for total body water? We already discussed. What is the dye? What is that? D2O, T2O. Now for what purpose we will use inulin as a dye? You just write or comment it down in the comment section. Okay. So that is all about so-called dietary intake, dietary fiber advantages. Now we will just discuss some of the words and their comprehensive meanings. If you talk about food, then obviously we are indicating about a movement, that is peristalsis. If you talk about feces, then obviously it is a mass. If you talk about fasting, causes increase migratory motor complex, cleaning of stomach. So that's why you can frequently eat meals but at least there should be a gap of 2 to 3 hours in between the meals. The reason is these things, they cleanse the stomach and get the stomach ready for the next meal. And if you talk about vomiting, that indicates reverse peristalsis. So these are some things that you should remember. Now we will discuss something about the phases of digestion. So here we will write the name of the phase. Here we will write the stimuli, and here we will write the mediator. Wait, I think it's better we move this. Stimuli, and here we will write the mediator, and finally here we will write the response. Listen this table very pinpointly, guys, because it is very important. Now the first phase is called cephalic phase. What is the stimuli? It can be the smell of food, or it can also be the sight of food. You see a good biryani, ultimately it starts the cephalic phase. You see a good malai puri or something like malai lassi, obviously that good sight of food leads to initiation of cephalic phase. Now what is triggered? Parasympathetic system, right? You won't get hungry while you are in a Viva exam, right? Obviously you don't get hungry. For example, you are in a Viva exam, final year pediatric practical. Will you think about something like chocolate lassi or something like faluda? You don't think about all those things, right? The only thing that triggers your sight of food is when you are calm, when you are cool. So the sight of food, it triggers the parasympathetic system. Obviously it won't trigger the sympathetic system. It's a common sense thing, right? So the sight of food triggers the parasympathetic system. It leads to, what does the parasympathetic system do regarding the secretions? It increases the secretion. We are studying it since pharma second year. In pharmacology we already studied parasympathetic system increases the secretion. So that's why if there are excess secretions during anesthesia, in order to prevent excess secretions, we give anticholinergics. That is the reason we give anticholinergics, to prevent secretions during the anesthesia phase, before going the preoperative surgery, right? So these all are interlinked mechanisms. If you know all these things, ultimately you can simply burst whatever the MCQ it is. You can simply get to the right shot. Okay, so the increase of secretion as well as the increase 10% of the HCl also, right? HCl secretion also, right? So that is all about cephalic phase. Now coming to the second phase, that is gastric phase. If it comes to the gastric phase, what happens is the food gets entered into the stomach. So what happens? Vagus is initiated due to M1 component. So please be just 1 minute.
చేస్తేను మారింది సార్.
కొద్దిగా పెరిగాయి చూస్తున్నాను లైట్, బట్ నాట్ అంతా బాగా నార్మల్గానే ఉంది.
ఫీవర్ దగ్గు కూడా ఉంది.
బాగానే ఉందండి, ఏం ప్రాబ్లం ఏం లేదు. జనరల్ మెడికేష్ వాడించండి. ఎంత 55 క్రాస్ ఉంటుంది, 55 క్రాస్ కదా. So we'll discuss. So what happens in the gastric phase is obviously the food enters the stomach, so that one is considered as gastric phase. Now which one is mediated or initiated? So that one is done by vagus or the M1 component, right? As well the gastrin hormone produced by G cells. Remember, this one is an MCQ. Most commonly we see the secretions of stomach are very important. The secretions of stomach, G cells, P cells, all these cells, what they secrete, what is their mechanism of action, or what is their functional importance, everything is a NEET PG direct question, right? So this mediates gastrin secreted by G cells. So what does they do? They increase maximum HCl secretion. They initiate maximum HCl secretion. Remember, as well they increase the gastric emptying also. Why? Because actively the food is coming towards the stomach. So if the stomach will not empty it actively, obviously it becomes to stasis, that leads to bloating of stomach. Or you heard about so many patients, they used to come to the OPD with the complaint of fullness of stomach. Why? Because if there is any imbalance in the diet, or if there is any imbalance in these mechanisms, it leads to food stasis causing bloating or fullness of stomach. See, this is what the beauty of physiology. You know the physiology, you can easily understand the pathology, medicine also, both of the subjects. So that is what the fun behind the physiology explanation. So this vagus, see, I think you might get confused. Wait, you might get confused. I will just do one thing. Wait, please be on. I'll do one thing. I think no. Yes, we'll draw a line here, because you should I should clear cut differentiate the phases, right? Okay, I think it's okay now. Wait, I should have done this before only. I'm a fool to do this now. Okay, no problem. Okay, so now I think you can understand this, the cephalic phase, then cephalic phase and gastric phase. Then comes one more phase, that is, what is the final phase? Intestinal phase. What is that one? Intestinal phase. So what happens in intestinal phase? Here, rest of the process which occurs in the small intestine, large intestine, until the climax, that is at the rectum or anus. So what happens is, the HCl present in the duodenum is the stimulus, as well as you have some other stimulus, that is food. Yes, food is also food acts as a stimulus in every part of the GIT, not only stomach, not only esophagus, in every part of the GIT food acts as a stimulus. Remember, these all are stimuluses. Vagus, even vagus also acts, initiates the stimulus. Distension, right, etc. So mainly the HCl in duodenum and food, these two mainly acts as a stimulus regarding intestinal phase initiation. Now, what are the cells which initiate their function in intestinal phase? The S cell. S cell, what it secretes? Secretin. S cell secretes secretin, followed by I cell. I cell, what it does? It produces cholecystokinin and PZ. Cholecystokinin from PZ. And L cell, what does L cell produce? GLP. Which GLP? GLP-1 and GLP-2. And there is another one, that is K cell. K cell produce GIP, intestinal peptide, gastrointestinal peptide, and also some hormone like enterogastrone, and some other hormones like VIP. What is this? Vasoactive intestinal peptide, then amylin, etc. So these all are mediators. These all act as mediators in intestinal phase. Now, what is the response you see due to these mediators? What is the response you see due to these mediators? Wait, I will draw a line here. Yes. So, what is the response you see? These mediators leads to alkalinity. Alkalinity gets increased. Food becomes alkaline with what? Bicarbonate rich food. Bicarbonate rich secretion occurs from where? Pancreatic. From pancreatic. Just wait. Why it's responding slowly, so slowly, like I was. Okay, so the food becomes alkaline rich but due to increased secretion of bicarbonates. From where? From pancreatic secretion as well as from bile, secreted from liver, bile and pancreas. They also increase insulin. Insulin secreted from GLP-1 and GIP also increase insulin. And decrease the HCl secretion. And decrease the gastric emptying. Now you understand everything. The cephalic phase, gastric phase, intestinal phase. Cephalic phase stimulus is smell as well as sight as food acts as stimulus initiating the cephalic phase. Mediator is parasympathetic system, leads to increased secretions of saliva and increase in HCl secretion, nearly 10% increase in hydrochloric acid secretion. The second phase is gastric phase. Stimulus is food which is present in the stomach, and the mediators are vagus M1 initiation and gastrin from G cell secretion. What they do is they maximize the HCl secretion as well as they increase the gastric emptying. So this leads to pushing of food towards the intestinal aspect. So third one is intestinal phase. So who are the stimulus here? HCl in duodenum, food, distension and vagus, etc. And who are the mediators? S cell produces secretin, I cell produces cholecystokinin, CCK, PZ, and L cell produce GLP, and K cell produce GIP, gastrointestinal peptide, enterogastrone, VIP and amylin, etc. These all are mediators. And what is the response that they produce? They make the food alkaline rich by increasing the bicarbonate content, HCO3 content, which is secreted from the pancreatic secretion as well as the bile secreted from liver. So pancreatic secretion and bile secretion increases the alkalinity of the food, which makes the food rich in bicarbonate. So also insulin is increased due to GLP-1 and GIP, and HCl secretion is decreased and gastric emptying also decreased. So these are the phases of digestion. So please remember this. Okay. Now I want to discuss one statement. So gallbladder, right, secretes, gallbladder also secretes its secretion. So what does colorectics do? One of the doctor asked me, so what is the function of colorectics regarding the digestion? So simply they increase the bile secretion. They increase the bile secretion. So who are the most potent colorectics? Most potent are bile salts and bile acids. Bile salts and acids, cholates and taurocolates. Cholates and taurocolates, cholic or cholates. Okay. Now we will discuss something about saliva. Saliva is secreted maximum from submandibular gland. Submandibular glands. How much? You say maximum, but how much? 70%. Now let's ask. Wait. Now, what is the pH of saliva? At rest, the pH is 6.8. But if you stimulate it, if stimulated causes, it's stimulated, the pH becomes 8.0. That means slightly alkaline. Here it is 6.8. See how much is less than 7 acidic, more than 7 alkaline. Remember, I think this basic also some of the students they might have forgotten. So that's why for those students I said this. So when stimulated, saliva becomes alkalinity in nature, that is 8.0. But if it rests, it is 6.8, which is slightly acidic. But why it becomes alkaline? Because due to increased secretion of sodium, potassium and bicarbonates, etc. So what they do is they increase the volume and also the pH, leading to produce alkalinity nature. Okay. Now what are the functions of saliva? Very important functions of saliva. No, that one is not a function of saliva. Boys, don't think about that. That one is not a function of saliva. No, leave it off. So first one is lubrication. Not the lubrication which you are thinking, boys, not that lubrication. This is another one. So first one is lubrication, second one is taste, third one is mastication. The important thing for which saliva is very much important, mastication. And fourth one is swallowing. Yes, this is also important, swallowing. Fifth one is it acts as antibacterial also. Can you tell me why it can act as antibacterial? Because saliva contains IgA antibodies as well as zinc, as well as defensin, lysozymes, etc. Okay, so that gives the saliva antibacterial nature. And one more important thing of saliva is digestive role by the enzymes. Which enzymes? That one we will talk. Which enzymes give the saliva its digestive property? First one is serum amylase, or you can also call it ptyalin. So how does the serum amylase gets activated? It's activated by chlorine, and it's optimum pH that should be there is 6.7. Right? So what does this amylase do? It breaks starch. It breaks the starch, that is carbohydrates, carbs. Okay. Now there is another thing, another component that is secreted by saliva. I will tell you, that is lipase, or you can also say lingual lipase. What is meant by lingua? Comment down in the comment section. Lingual lipase and peptidases. Now we understand? You understand or not? Yes. 1 minute. One minute, please. 1 minute. I just want to bring some water. 1 minute. Okay. Okay guys, I am back. Okay, so I got my energy again, so we will start. So second enzyme that is being produced in the saliva, that is lingual lipase, as well as also produces peptidases, right? So with this we finished the saliva component. So just remember the two enzymes, that is serum amylase and serum lipase, also called lingual lipase. Okay, so these things are important. Now we will discuss about gastric phase. Very important. We will discuss about gastric phase. So what are the main cells in the stomach? Gastric glands. Very important. Gastric glands are obviously in the main cells in the stomach. Why? Because they do the main primary functions of the stomach. What is the primary function of stomach? Digestion. So the gastric glands are the main cells in the stomach. So what are the gastric glands or the main cells present regarding the gastric glands in the stomach? So we will start with the first one, A, that is oxyntic cells or parietal cells. Parietal cells or oxyntic cells. Guys, from this point you just concentrate, right? Oxyntic cells. Right, you just listen to each and every statement. No need to revise second time if you listened it for the first time only. Okay, so these parietal cells and oxyntic cells, they are maximum at the fundal region, fundus of the stomach, right? So what is their main function? So actually we have something called proton pump present at this region, which leads to HCl secretion. These proton pumps cause HCl secretion. Okay, so what is that proton pump? proton pump. I will just write down here H plus or potassium plus ATPase pump and bicarbonate or chloride exchanger. So what does this proton pump do? This proton pump, right, increases the HCl secretion. Okay, increases the HCl secretion. So this increased HCl in the lumen, increased HCl in the lumen causes gastric digestion, and also they increase what? They also increase the bicarbonate in blood. Remember, very important, bicarbonate in blood, which leads to alkalinity pH, right? These two things are important. Now what are the proton pump? See, so this proton pump obviously increase the HCl secretion. These are the factors that increase the HCl secretion. So if you inhibit the proton pump, so obviously the HCl will decrease. So in which condition we should decrease the HCl component, right? Gastritis. So what are the drugs that inhibit the proton pump? Proton pump inhibitors: pantoprazole, lansoprazole, esomeprazole, omeprazole. These all are proton pump inhibitors. Okay, so in this way you can learn pharmacology as well as physiology also. Okay, so that is the importance of proton pump. Now second one is, there is also present of intrinsic factor. Right? So what does this intrinsic factor do? Actually, what is the full name? Cassell's intrinsic factor. It is Cassell's intrinsic factor. It helps in binding of vitamin B12. Vitamin B12 present in the duodenum, and it is absorbed in terminal ileum. Right? Terminal ileum. Now if this intrinsic factor defect occurs, Cassell's intrinsic factor defect occurs, it leads to megaloblastic anemia. Guys, please, that's why I am asking you to concentrate. No need to revise once again if you concentrate right now, right? So concentrate. So the defect in intrinsic factor leads to defect in the vitamin B12 absorption, that leads to megaloblastic anemia. Now I am asking you the question, what are the main features, histopathological features of the megaloblastic anemia? Please comment it down in the comment section. Okay, now we will go to the third component. So we will see three components in the parietal or oxyntic cells. First one is proton pump, second one is intrinsic factor, and the third one is ghrelin. What does ghrelin do? It increases the hunger, as well as it also acts as a growth hormone. Right? Now that is all about parietal cells or oxyntic cells. Now coming to the second type of cells, it is chief cells, or also called zymogen cells. Chief cells or zymogen cells. So actually they produce some sort of inactive enzymes. Right? So what they produce? They produce something called pepsinogen in the presence of HCl, right? Converts to pepsin, which is the active form. So that's why we already discussed, these zymogen cells or chief cells produce inactive enzymes, which in the presence of HCl secreted from proton pump, this HCl gives the support to convert pepsinogen to pepsin. This pepsin is the active enzyme component, right? So it becomes pepsin, as well as they increase the HCl by initiating the vagus with the help of acetylcholine at M1 receptor, right, as well by initiating the ECL cells. ECL cells means anyone? Enterochromaffin cells, enterochromaffin like cells. What they produce? These ECL cells produce what is there? They secrete histamines. As well as 5-hydroxytryptamine, So this histaminics. So we were discussing about antihistaminics, right? In the pharmacology, we will discuss about antihistaminics as well as 5-hydroxytryptamine antagonist, right? So 1 minute, I will come after 2 minutes, right?